Sweet. Hey, how you doing? And welcome back. We have Anderson, who's going to read today, and then I'm going to do the color commentary again. I hope we had a lot of positive responses to the last video where we were sitting at the fish tank talking about stuff. So we're going to go ahead and do another blog, and I guess this is now considered a vlog. So I'll hand it off to Anderson.
Hey, how's it going, everybody? I'm Anderson. I am going to be reading today's blog. The title of today's vlog is Will I Need a Bunch of X-Rays? Good question.
Yeah.
Hello, and thanks for taking the time to check back in with the Paragon blogs and vlogs.
Thank you.
Video blogs.
Yep, thank you.
This is a question we get asked quite a bit. Will I need a bunch of X-rays? Most patients would rather avoid films and many of the diagnostic tests they get from their primary healthcare provider. Most balk at the expense and the fact that it takes weeks to get the results, if they get them at all. This can cause a lot of worry and angst that really doesn't do anyone any good. At Paragon Chiropractic, we do not routinely x-ray every patient that comes to see us, and only after a thorough history and examination will the decision for studies be made.
Yeah, we don't just do stuff to do it. So we'll listen to you and see what's what and what's going on, and you know, maybe we need to get some films, maybe we don't, but we don't just run you through the mill. You know, you don't come into our office and we do this, and we have all these tests, and then we sit down, all right, now, what's your problem?
Right.
You know, kind of dumb and wasteful.
We figure out who you are and what you need before we don't just run the gamut on you and go, okay, what's going on? We try to do personal health care, right?
Yeah.
Let's see. Yeah, I'll give that last sentence again. At Paragon Chiropractic, we do not routinely x-ray every patient that comes to see us, and only after a thorough history and examination will the decision for studies be made. Obviously, if diagnostic imaging is warranted to rule out a broken bone or some structural problem, we might not be able to overcome with our functional... Let me give that again. Obviously, if diagnostic imaging is warranted to rule out a broken bone or some structural problem we might not be able to overcome with our functional therapies approach, well then yes, a patient would be sent for x-rays, MRIs, or even another healthcare practitioner for evaluation.
Yeah, and that's basically it. Our approach is always restoration of function. You know, you are what you are, you know, and it's like, let's see if we can't make it work. And that's all we are. And if we can't, maybe there's a structural thing or another reason why, and we'll look. But let's just make it work, because usually working is what fixes the problem.
Here's the thing about routine x-rays. Most x-rays will show degenerative joint and disc disease, along with any type of arthritic changes like osteoarthritis. A person's doctor will usually call all of this arthritis and advise the patient to learn to live with it.
Yeah, that's the big thing. You know, people will come in and they're surprised. You know, they're 50 years old and there's some wear and tear in the joints, and the doctor called it arthritis, and it's like it's some sort of a death sentence, and it really isn't, as you'll see as we go on. It's just part of what's going on, and that's why we like the functional approach, because everybody's got something, but we can always make it work better.
These degenerative changes are considered to be part of the normal aging process and typically do not cause pain. So why is the patient experiencing pain? Let's look at osteoarthritis. Considered for many years to simply be age-related wear and tear, it has been learned that osteoarthritis is really an autoimmune disease, meaning one's own immune system is degenerating the joints and surrounding tissues. Unresolved inflammatory conditions destroy the cartilage, bones, and ligaments. These tissues then being repaired with scar tissue that in time calcifies.
Yeah, that's the whole thing. It's an inflammatory problem. So the inflammation is destroying the joint, and your immune system in repairing and doing is actually further destroying the joint. So even osteoarthritis is considered an autoimmune situation, and it's just unresolved inflammation. So the joint breaks down, it's repaired with scar tissue. In time, the scar tissue calcifies, and that's where you get all that crunchy, and all the rest of the stuff, crunchy. Yeah, it's unresolved inflammation.
Mm-hmm. It's the unresolved inflammation that causes the pain.
It's like I wrote this. Yeah.
Oh my God. Oh no, not that lifestyle stuff again.
Oh yeah.
Yeah.
Yep. You're your own worst enemy.
And maybe your best healthcare provider too.
The only one.
Hey, I'm afraid so. Inactivity, overactivity, poor diets, unresolved inflammation, leaky guts, not enough sunshine, poor sleep, and unhealthy gut bugs all result in a smoldering fire that just burns away at the tissues.
Yeah.
One can go to his medical doctor and get a handful of pills to make the pain go away, but they will not extinguish the slow smoldering fire kept active and alive by poor lifestyle choices. Those being no sleep, processed foods, sugar, no exercise, no sunlight, no nutrient-dense whole foods, drinking booze, smoking drugs, etc. If you are sitting in my office complaining of pain, that's an inflammatory condition.
Yeah, that's an interesting thing. People come in, their back hurts, or their knee hurts, or their hip hurts, or their shoulder, or something. What's the problem, Dr. Dave? You're inflamed. That's why it hurts. The joint receptors, the pain receptors, are aggravated by one of two things: either a mechanical force or a chemical force. So if it's inflammation, it's a chemical thing, and that's why it hurts. And once that inflammation starts to go away, it doesn't hurt. You're inflamed. That's why it hurts. That's why you're in pain.
It makes sense that, yeah, if you went and bumped yourself and you got a little bruise right here, if you have a perfectly working body with a perfect lifestyle and a perfect diet, that thing's healing up within a day, and you're hardly going to feel it. I mean, there's going to be some pain there, but no chronic, prolonged pain. Your body's going to handle it. If you got an inflamed body, it's already handling so much other stuff that, yeah, I'll get to that. Yeah.
It's true. There's only so much you can do. And if it's putting out inflammation from food and all sorts of other things, there's really nothing left to fix that sore knee or ankle.
Right. I'll give that again, why not? If you are sitting in my office complaining of pain, that's an inflammatory condition.
Yeah.
So without film, I know what's causing your pain: self-generated inflammation and inflammatory lifestyles. And, more importantly, I know what will correct it: changing one's lifestyle to allow for the resolution of chronic inflammation.
Oh, again, not again.
Right? I mean, come on, there's got to be a pill, Dr. Dave, right? Something that I don't have to really be a part of, and I can just kind of...
There are plenty of pills.
There's plenty of them. They're very expensive and cost more than money, too.
Yeah, a lot of people don't even realize this. When you get the anti-inflammatories and stuff like that, you actually are supposed to be scheduled for blood work every 6 weeks. And it's not to see if it is destroying your liver, but to see how much it is. Isn't that interesting? So when your doctor writes you that prescription, did you get set up for your blood work? No. How about that?
Yeah.
Something to think about. Oh, and you still got the inflammation, and now it causes all sorts of other inflammation and destroys the intestinal linings, which is more inflammatory, and destroys the kidneys and liver, and
not worth it. Just handle the problem at the source.
Yeah.
Here's another potential problem with unwarranted diagnostic imaging. Often patients see the degenerative changes and all the things that are wrong with them, and they decide that they should probably start to take care of themselves, take it easy. So they stop exercising, walk less, become more and more inactive, and start eating more comfort foods. That is the road to ruin. Limiting motion and activity, becoming sedentary, and gaining weight by eating inflammatory foods. And this is taking it easy on oneself.
Yeah, you see, that's the whole thing. And oftentimes they'll find, there was a study that was done a number of years ago, and people went to go see the doctor, and one group got MRIs and X-rays, the other group didn't, which is kind of an interesting thing. Then they asked the patients, what they thought of their doc. Oh, the ones that did the x-rays and those doctors did everything they could. The guys that didn't do that, they were good, but not so great. 2 years later, prognostically, the people that didn't have the x-rays and the MRIs, they were almost all symptom-free, whereas the people who did have the studies still had aches and pains and things along those lines, and that's what they figured they were doing. They saw the degeneration, they saw the things, so they started to take care of themselves, and they stopped moving, and they stopped a lot of different things, and they actually got worse.
Their lifestyle got worse.
Yeah.
At Paragon Chiropractic, our approach is the restoration of function regardless of any structural problems a person might have. We'll try to make it work and get you moving unless it becomes obvious that we cannot overcome a structural problem or there is a life-threatening situation. Sometimes medication and surgery are necessary, and once your life is saved, then let's see if we can get you back to living and creating your life again.
Yeah. Function.
Oh yeah. But know that should we need diagnostic imaging of any kind, we have a number of facilities that we can use and with discounted rates. In many cases, we can get you in for an MRI within a day or so and have the results by the next day.
Yeah, patients will come to us and they decide, it's like, well, their medical doctor can get them in for an MRI in about a month. And it's like, I can send you to the facility he's going to send you to or she's going to send you to tomorrow and have the results either at the end of the day or first thing the next day. And I think right now, don't totally quote me on this, but the one lab that we use or the one diagnostic imaging facility, I can get you a low back MRI for about $240 cash. And that's something to think about. So get you right in, get your results, see what's going on, and have you resolved before you ever got your appointment.
Before you ever start waiting out for a month. I think your time and energy is worth a lot. And so having a month of time injected in this, space where you can just, let those thoughts fester and go, oh, maybe it's this, or maybe it's that, or maybe it's this thing that my dad had. It's like, oh, okay, you're gonna slow down. Let's get this handled today and tomorrow, right? I mean, let's.
Yeah, same thing with blood work. We have labs that we'll send you to, so they'll draw the blood there. So your blood isn't sitting in a refrigerator and then driving around Phoenix for a day before it gets someplace. You're right there at the lab, they do that, and like that we have your results. And again, cash prices. A lot of these blood studies, x-rays and things along those lines. X-rays, $25. I mean, I remember $250, $300 some time ago. Blood work was outrageous. We can get a blood screen panel for $25, $30 nowadays, and again, these are cash prices, but
it's worth it.
Right now, no playing around.
Yeah. And the same is true for any laboratory tests, like Dr. Dave said. It should be noted that with everything I've said, I would never discourage a patient from getting a second opinion or receiving diagnostic imaging or other tests.
Yeah, I understand. I'm not discouraging. I'm not saying, oh, you're stupid for doing it. If you want the studies and everything, we can send you, and I'm never going to say, oh, don't waste your time. No, it's all good. You may or may not need it, but I would never discourage anybody from getting a second opinion or going for x-rays or MRIs or blood work or anything that they felt they needed to solve that mystery in their head.
Mm-hmm. It is the intention of this blog to take another approach to encourage our readers and viewers to start getting a little more involved with their livingness, making those lifestyle changes that promote health and wellness. Take care.
I'm Dr. Dave, yeah. So, and that's really it. Oh, they all boil down to the same thing. You kind of have to participate in your own life and your own wellness. And so from the perspective of x-rays and blood work and stuff like that, we managed to bring it all right back to lifestyle and what you eat and how you do and your participation in your life, and that comes out to your health and well-being. So All right.
And if you are watching this on YouTube, I encourage you to really watch it on YouTube. From what I've heard, Dr. Dave and I sound similar, so watching our individual mouths moves will help you figure out who the heck is talking.
Yeah. Yeah, and again, any comments, please let us know what you think.
Please.
It's always great. I would love to have comments and what you think. So often we do these and it's like,
where is everybody?
yeah, I hear crickets chirping and it's like, ugh.
If you've got a whole other blog to comment, go right ahead. If it's just a thumbs up, then that works fine. I mean, really, any sort of something you can give us, that is perfect.
Yeah, that would be great.
All right. Hey, enjoy the rest of your guys' day.
Take care. All right, thank you.